Hi, my name is Emmanuel MONNERON and I work as a psychiatrist in France, and this is another video for the series Psychiatry and the Trouble Teen Industry. If you don't know what the Trouble Teen Industry is, you can follow the links in the description of this video to visit the Breaking Code Silence organization website and find useful information about this industry. This new video is going to be about how difficult it can be for TTI survivors to trust therapists after a behavior modification program and how it can stop them from getting appropriate help and start healing. The first thing to remember is the fact that a lot of survivors were sent to wilderness therapy programs and residential treatment centers by medical professionals, therapists, and education consultants. These people who are supposed to make the best choices to help vulnerable children sent them to places where they were isolated from the outside world, emotionally and sometimes physically abused for weeks, months, or even years. Now let's talk about the role of a therapist in a behavior modification program. I'm going to give some basic information, but if you want more details about that, I already created a video about individual therapy, what it should be about, and what it is in the Trouble Teen Industry facilities. So you can go watch this video and come back to this one afterwards. In these programs, the therapists are not always licensed and are involved in the decisions made by the staff when it comes to rewards, punishments, and progress through the program. It means that they share information that should be kept confidential with the rest of the staff, and that depending on the information shared, the resident can be moved back to lower levels of the program, condemned to spend more time in the facility, or even sent to isolation for extended periods of time. During the individual sessions, the residents are expected to demonstrate that they walk the program. It means that they are expected to share private information. They are also forced into confessing bad things they might have done, whether these confessions are true or not, and expected to take full responsibility for being sent to the program, which actually doesn't make sense, especially for the survivors who were sent because of mental health issues such as depression, anxiety, eating disorders, or substance abuse, for example. But that's not all. The private information shared during the individual sessions are also weaponized during some group therapy sessions named attack therapy. During these sessions, one of the residents is targeted by the rest of the group, which is encouraged to shame or even insult or hit the resident in order to break them. I think that is enough information to make you understand how important the therapist's role is in these behavior modification programs and how much they are responsible for the physical and emotional abuse the TTI survivors have experienced. Because of all this, and even if some of them would really like to get some proper help to deal with all the trauma they were left with after the program, the fact that it can be quite difficult for the survivors to trust someone who call themselves a therapist is not surprising. But if you are a Trouble Teen Industry survivor watching this video, I want to take advantage of the Mental Health Awareness Month to tell you a few things from my medical professional point of view. Deciding to start going to therapy should always be a personal choice. What you went through during your program couldn't be therapeutic in the first place because you were deprived of the ability to make this choice for yourself. But it's different now. You're an adult and you can decide to start going to therapy or not. You can choose the professional you're going to meet by yourself. You can ask for advices. You can change your mind, back out if you want to, or meet another professional if you don't feel okay with the therapist you're seeing. It's a completely different situation, and going to therapy could really bring benefits if you feel like you need help to deal with everything you went through and all the trauma you were left with. Know that most mental health professionals will consider that what you went through was extremely abusive. Some of them may have troubles believing that these practices still exist in the USA in 2021. And that leads me to something important. The fact that mental health professionals don't know about the Trouble Teen Industry doesn't mean they don't care. It means that this is a well-kept secret and a lot of people need to be educated about this industry. So please be patient. You know something a lot of people don't know. Not being aware of this doesn't make your therapist a bad professional, but it doesn't make you responsible for educating them either. There are online resources, including the Breaking Code Silence organization website and my channel, that they can use to find proper information. It's very important to remember that therapy should always be a safe space. You should never feel pressured to share information about yourself if you're not ready to share them yet. Forcing a survivor to talk about traumatic events can make PTSD symptoms worse, and it's not something a proper trained mental health professional would do. The last thing I wanted to add is the fact that a therapist is not family and they're not a friend either. They should not share their personal opinions about your choices, and they should never enter into a personal relationship with their patients. This would be completely unethical. If you feel like you're being judged during therapy, or if you feel uncomfortable about the therapeutic relationship, remember that you're the one making the decisions, and you can back out if you feel like you need to. Additional resources about therapy and mental health, and also contacts, can be found in the video Breaking Code Silence shared on social media about Mental Health Awareness Month a few days ago. You can find the link to watch this video in the description. Make sure to follow the organization on social media. You can also like this video, share this video, and subscribe to the channel if you want to see more videos in the future. Thank you very much for watching and have a great day.